Welcome, folks. My name is Stephen Beeson. I am a family medicine physician and founder of Practicing Excellence. And here today we are celebrating Doctor's Day, uh, March 30th, 2025. And I have colleagues with me that we want to spend some time with in recognition of the work that they do, the life of doctoring today and what that's like, the good, the bad, the ugly. And we have some amazing clinicians here with us today. So this is just a chance to sort of dive into doctoring. And I'm going to have the folks introduce themselves. And Ken, we'll start with you, your name. And I want you to add something, your role certainly, but something about you that we would never know by virtue of what's publicly available on Google.
All right. Thank you, Steve. It's wonderful to be here. So I'm Ken Morris. I'm a pediatrician. I am the chief medical officer at Children's Primary Care Medical Group, and I've been with the group for 6 years. I actually started my career at a federally qualified health center for the first 22 years of my career, and so something interesting that you'll never find on Google. Maybe not related to medicine, but I'm actually related to David Lee Roth, who is the lead singer for Van Halen. So you definitely won't find that, but an interesting note because I'm completely musically illiterate. So the fact that that runs in my family genes is somewhat of note.
Right. So you're related to David Lee Roth. Do you know him?
I've been to his concerts. My father actually gave him his first stereo set when he was growing up, and sort of launched him on his way to becoming
Oh my
famous in the
gosh.
music industry. So it's pretty interesting, especially if you're into Van Halen.
Yeah, well, I didn't know that about you. That's pretty cool.
Yeah, yeah.
So, thank you. And Megan, how about you?
Hi, I'm Dr. Megan Morris, and I'm family medicine, and I've been practicing for 10 years. I'm also the Associate Chief Medical Informatics Officer at Baptist for their ambulatory division. And something that you won't be able to find on Google is I'm very proud of being a winner for a hackathon where we democratized patient data, and it was a website that allowed patients to upload their data and then sell it for research so they could profit off their own medical information.
Oh my gosh. That's a very cool project. It's kind of nerdy in a super cool way.
I have
Right.
definitely been called nerdy
That's
before.
right. Well,
That's not a surprise.
it's the greatest of compliments. And it sounds like a really powerful hack. So that's awesome. So Lisa, tell us about you.
I'm Lisa Bowie. I am a family physician. I have been with Sturdy Health in southeastern Massachusetts for 23 years, and I am part-time clinical, part-time medical director for primary care for our medical group. And interesting fact about me, I guess, that you wouldn't find online. I say my last name Bowie, not Bowie, and I am not related to either David Bowie or Jim Bowie of the Bowie knife. And the reason it's pronounced the way it is because in Scotland, my last name was spelled Buey. And when my great great grandfather came to the US, as happened to many people when they immigrated, the way our last name was written down, the spelling was changed, and now it's Bowie instead of Buey.
Yeah, I was a little curious about that when we introduced ourselves to each other. So, well, first of all, thank you for what you do for physicians everywhere that are listening and those that are not physicians who are listening. Just a recognition of the contributions that physicians make everywhere, and it's a massive sacrifice. It's an amazing opportunity, and it's hard right now, quite frankly. But it's also amazing in terms of making a difference in the lives of patients. So this first question, and maybe Lisa, I'll start with you and I'll go in backwards order. What was the experience or person that you went through that prompted you to say, I'm going to do that in my life in terms of becoming a physician?
Yeah. I would say probably not a person, but definitely an experience. When I was in high school, I actually wasn't going to be a doctor or professor or any kind of business person. In my very immature view of the world, those were all very high power, sort of high pressure jobs I didn't want to do. But when I was in college, I developed an interest in sports medicine, and was lucky enough to be in a place that actually offered a sports medicine class as part of our athletic department, which led to a job as a student athletic trainer associated with our athletic department. And I did that there for 3.5 years and thought that that would take me into a career in physical therapy. But after 3.5 years of taking my athletes to emergency rooms and doctor's appointments and being on the field and dealing with their injuries and their wounds and things, I realized that I wanted to be more active in actually taking care of the whole patient and not just the orthopedic injury or the neurologic issue that would have been addressed in a physical therapy setting. I wanted to take care of their mental health and their physical health. And that drove me to apply to med school. And here I am.
Right. And it's the best thing about family medicine. It's that entire cycle. I was talking about this to somebody yesterday about the entire cycle of life in every different circumstance, and to be able to see diagnoses at the front end when they're presenting with a constellation of symptoms and we have to figure it out. It's the best thing about primary care. Megan, how about you?
Well, for me, it was very personal. So I was really young when I got a Fisher Price physician's kit. And so I was maybe 4 or 5 years old, going around giving my stuffed animals immunizations and doing checkups on them. And then at school during recess, I used to have a desk with like a table and a chair, and I used to do care on the playground. So for me, it was always a calling. It was just something, nothing else was right for me, apparently.
Yeah, it's so interesting that burning calling inside that says, I want to deploy an action to help somebody on something. It's obviously can power life in medicine, but it's interesting that it came up so early for you and drove you to where you are right now. So, Ken, how about you?
So I was fortunate growing up being exposed to the healthcare arena. My father and my uncle are both orthopedic surgeons, and I saw probably the good and the bad of medicine. The good is, I did get a lot of endorphins hearing from patients talking about the interactions with my father and how much he meant to them. But I also saw the kind of the bad side of what I would call bad physician behavior, and sometimes saw my father yelling at nurses. And I said, if I'm going to go into medicine, that's not going to be me. We're gonna change that. That's just not a collaborative way to work. I used to teach swimming lessons to kids, and I really connected well with kids. And what I found was that I could connect with the children, I often was able to connect with the parents. And so I think going into pediatrics, worked great for me. I did not have the feet to stand and be an orthopedist and like Dr. Bowie, I had visions of being involved with sports medicine, and I still can do that, with pediatrics. So I really love working with children, and I'm happy where I ended up in my career.
I love that that idea of finding the place that you personally thrive in medicine, both in terms of the people that we work beside. It's different working with a group of neurologists. I'm not accusing anybody than it is pediatricians. It's a different tribe, if you will. Both amazing, wonderful in different ways. Tell me one thing that you love most about being a physician. If you were talking to somebody who's thinking about it and you say, this is the best, for me personally, this is the best thing and the thing that I love the most. What is that for you? And Ken, maybe I'll start with you.
it was interesting. I think all of you are probably familiar with the book House of Gods, and the author would talk about his interactions with patients, and he was always thriving to get this. If he got the response, "God bless you, doctor," he knew he had connected with the families, and that he'd done a good job. And so, very early on in my career, I learned to speak Spanish, and I had and I still do have a lot of Hispanic patients. And, I know when I've done a good job when I get, it's called muy amable, which translates to you're very kind. And so I used to sell that to the other docs I work with. We all should be getting muy amables. And when you get multiple muy amables, you're connecting. And so for me, every time I get a muy amable, it's always very heartwarming, and it's reassuring and affirming that I feel like I'm doing a great job with my patients.
Right. It's so beautiful. When we have a chance to sort of get a feedback loop from a patient that we made an impact, it's really a beautiful thing. It's a beautiful thing. Megan, how about you? What's your favorite number one thing about being a physician?
Number one thing probably is when I was a hospitalist. There was no better feeling for me when you have someone who is at their very worst, sick, unhappy, scared. Being in a hospital is a very intimidating and intense situation. And obviously, you're meeting them for the first time. You don't have a relationship with them. So the best feeling for me was when they asked if I had a clinic that they could come to afterwards, because they had connected with me in a very short period of time. So that for me was the most rewarding thing I could ever receive from a patient.
The most compelling proxy of patient connectivity is, can you be my doctor? I've seen you in a little tiny window, heard you and experienced what your care is like and how you show up as a human, and I want you to take care of me forever. That's pretty powerful. Yeah. Lisa, how about you? Your favorite thing? Oh, you're on mute. We had to do that once.
I think that they both touched on pieces of it. It's how the connecting to the patients, how they respond to you. I guess to expand on a little bit more, I would say for me, doing outpatient practice in a pretty stable panel, it's the moment when a patient that you've been working with for a specific issue for an extended period of time, trying to talk about lifestyle change or when and how to take their medicine, or whatever it is, that it's taken a while to get them on board with the plan and doing it on a daily basis and consistently. And then finally, either I am able to figure out the motivation they need to do it, or the patient gets to that place where they're finally connecting to the conversation and hearing it, and they come back to the next visit and say, I did it. I feel so much better. Let's keep going. That's really a huge moment for me.
And it's really hard to be able to leverage trust and relationship and information education to activate patients to care for themselves. We're pretty good at telling people what to do, but that usually doesn't work. So, but what a beautiful thing to be able to have that insight to say I was able to activate that patient to take an action to advance their health. Another question I have, and particularly for non-physicians that may be watching this, what's the toughest thing that you would want people to know about doctoring today? And because some parts of medicine are hard. I mean, we had the beautiful opportunity to connect and impact and advance the wellness of the patients inside the exam room, but there's also other things about doctoring that are hard in this moment. What would you say those are for you right now, in your experience? And Megan, maybe I'll start with you.
It's a tough one. I think that for me, probably it would be that I really do put the patient and patient care above everything else, to the point where I'm not very good at looking after myself sometimes, because there's always the priority of the patient. And so I don't think patients and people outside of healthcare understand the sacrifices that the quiet sacrifices that we make, kind of thing, to put others first.
Yeah. That's a really big deal. Yeah. Was there a point in which that realization was coming true for you to say, I am putting my patients above me? And was there a point that you realized that that was happening? And and the second question is, did that awareness change how you were approaching the practice of medicine?
I've always considered myself to be a servant, even in leadership. Servant leadership is my style. And so I think it's just my personal way of doing things and my personal philosophy. I think that it's a matter of not letting the cup fully run dry and ensuring that you are maintaining enough of a balance that you're able to produce the high quality work. So in today's system, I think that there are a lot of pressures, and it is more difficult to be a physician today than in any other time period since 1950 or something like that I can reasonably say I have data to support that comment. But I think for me, it's just a matter of trying to take the advice that I'm giving others when I'm helping other physicians. So, do not just what I'm telling people, essentially.
Right.
So.
And those neural pathways probably began when you were very, very young, when you were going out to care for people during recess. That was that servant approach, and it's beautiful and amazing, but it's also a risk for um, self-sacrifice. So thank you for honestly sharing that. Lisa, how about you? And you can undo the mute. There you go. In terms of the things that you want the world to know about doctoring today that you've experienced personally.
Ugh. I mean, I think there's some things that we do talk about with patients, like the barriers of the care we want to give that we can't get access to for our patients because it's not covered by their insurance. And now, I at least in the Northeast, we see this a lot. It's also the barriers of the patient with the high deductible plan who can't pay out of pocket for the care that we want to give them, whether it's even the visit, and that, we want patients to know that we worry about them when we can't do that. It's not, even though what we have to say to them is that we can't get this medicine for you or this test for you, it doesn't mean that we don't want that to happen for them, or that we don't worry about the consequences if we can't get that to them for them, and that we're always trying to figure out what it is we can do instead that will work for the patient. And so we spend a lot of mental energy outside the 15 minutes in the exam room trying to solve those problems
Yeah.
For our patients.
Yeah, I would imagine. And I'm gonna come to you, Ken, but I want to have any one of the three of you or all of you answer this question. Do you find, in terms of looking at the column of medicine is tougher now, do you think patients are, how should I say this? More demanding or uh, expecting more from you? Is that a signal or a pattern that you're seeing in the exam room as they go to Chat GPT to find out what their diagnosis is and what the evidence-based treatment plan should be, and they bring that to you? I'm using that as an example, as a proxy for patients having voice and authority in the exam room. What are you seeing right now in terms of the patient profile and how that makes medicine harder or easier today compared to 10 years ago?
I think we definitely do see that. It's not every patient, but certainly, they have access to so much more information now. And in a lot of ways, it makes our jobs harder because they come in with the list of tests they need based on their internet search or the medicine they think they should be on, and we can't, they're either not always clinically the right thing to do for them, or they're not something we can access. The particular medicine isn't the one covered by their insurance, those types of things.
Right, the
But
one that had the commercial on it is not the one that's on the formulary. Right.
I also sometimes think it makes things a little bit easier in some situations and with some patients, I guess, in that you can say to the patient, well, what is it that you found in your research that you are most concerned that you have going on? If a patient comes in and they're super worried about a particular symptom, that my initial reaction is that is not, I'm not worried this is a life-threatening condition. But if I can understand that the patient went online and they found this diagnosis associated with this symptom, and that is their biggest worry, and I can ask that question, I can very quickly explain clinically why I don't think they have to worry about that. And that actually makes for an easier visit.
Right,
So
right. Identify what the
go
patients are
both
most
ways.
afraid of. What are our favorite questions, right? What about all that you're going through right now worries you the most? And then
Right.
what a illumination and helpfulness that is in terms of the specificity of how we communicate with them. Ken, what about you? What's something that you want the world to know about medicine, about doctoring, and curious as to your take on patients today compared to a decade or two ago?
Yeah, no, I've now been in medicine for coming up on about 30 years. And, it's interesting. My father didn't want me to go into medicine because it's changed so much. And I said, yeah, well, I'm coming in at a different point that you came in. And if, my kids decide to go in it, they're going to come in at a different point too. So I have seen a lot of change. And perhaps the biggest change that I've incurred is going from paper to electronic medical records. And what's come with that is the opportunity to connect in a different way with our patients than at least when I first got into medicine, and particularly with the portal. I can send a quick message. The flip side is my patients can send a quick message, and because you
Right.
can communicate much more rapidly, there's an
Mhm.
expectation for the most part from our patients. Well, you can communicate with me quickly. I need the opposite. And so there's this expectation of, well, I just wrote you 10 minutes ago. How come you haven't responded, yet? And so I think that's been the hardest thing, is trying to manage expectations both ways, mutual
Right.
expectations, and things that have come along with the electronic health record that weren't there, before then.
Right.
That for me is one of the more challenging areas.
Right. So, it's really compelling. And Megan, I was very touched by your story about the continual human dedication to servanthood to make a difference in the lives of patients and what the consequence of a life of that can be. And you can empty your own till without awareness or without countermeasures for that. And Lisa, you sharing, sometimes we have really barriers to, we know the right treatment plan, but we cannot access it. And that's every day throughout the course of a day with formularies and high deductibles and Ken, what it's like, the portal management, for those that are listening that aren't familiar with the portal, it's an electronic secure communication directly from patient to clinician. And you can get 80, 90 a day, each of which is a clinical query. It's not like, how's it going? I'm doing well, thanks. It's potentially a complex, high anxiety query, and knowing that that's in addition to all the patients and all the prior auths and all the work and the storms that occur throughout your typical 20-25 patient day. It's just invariable. Somebody's going to come in with something that you didn't anticipate. So anyway, incredibly grateful to all of you for all that you do and for doctors everywhere. It's a massive sacrifice to become one. And it's a great privilege to be one. And today is a day to recognize that. And as we close, I'm going to ask you, the last question is, who's a physician that you want to be able to call out for making a difference in some way, shape, or form for you, as a friend, as a colleague, as a mentor, whatever it may be? And if you can, even call them out by name. I would love to hear the story of a physician who made a difference in your life, so we can go from recognizing the three of you to recognizing a larger group to recognizing doctoring in general. But maybe Ken, I'll start with you. Is there somebody that you want to be able to call out?
I'd love to call somebody out. I'm going to go off script a little. It's someone in healthcare, but not a physician. So, when I was at my FQHC, my boss, her name was Irma Koda, and Irma grew up. She grew up as a migrant farm worker. She was picking strawberries and had really no direction. Her mom had passed away. Her mom was a single mom. She ended up being steered to college, got her MPH, came to the clinic I was at, and it was her third job coming back and running a $60 million company and being the chief executive officer. And we were partners for 20 years, and I learned more about leadership and medicine and healthcare from Irma as much as any physician who helped shape my career. So if you're looking for inspiration, it's hard to look beyond that.
Oh, that's awesome. And we'll make sure that she knows. So that's a beautiful story. Megan, how about you? A doctor or physician or a just difference maker that you want to be able to call out?
That's a tough one. I've worked with so many amazing physicians, and I've been trained by so many amazing physicians. I used to carry around a black book of pearls, I used to call them. And it used to be not the medical knowledge, but the hard won knowledge over 20 years of practicing of this is how you say something to a patient. These are the words that you use. These are things to think about. And so when you asked that question, I came up with a list in my head of everyone. I think probably I'm going to call out Dr. Mary Ripple. She's the head of the Office of the Chief Medical Examiner's Office in Baltimore. And she's an amazing pathologist, but her perspective on her patients who are deceased is that they are the most vulnerable of all patients because they no longer have a voice. And so forensic pathology is an opportunity to, as a physician, to 100% represent the patient in a way that they can't. So it was an amazing perspective I hadn't thought of before. And so I thank her for that.
And if that helped you and how you approach care, what an incredible gift that is. I want to make sure my patients have a voice, and whether they're upright or not. So I love that. Lisa, how about you?
So I think Megan has a really great point, is that so nearly everyone you come in contact in your career helps to shape you, whether they teach you good habits or bad habits, or teach you one moment of perspective or a career worth of mentorship and guidance. So like all of us, even Megan and I are doing clinician coaching together, and I feel like listening to Megan talk in that setting has helped me, and I've learned from her. But I'm going to go with specific shout outs for kind of bookends of my career. Two athletic trainers that I worked with in college, Sharon Sharp and Patricia Cordero, really were my very first exposure to that continuity of care for patients, and showing me how to treat the athletes as patients and people and take the best care of them, and encouraging me to think about how I wanted to take that and where I wanted to go in my career with that. And then one of my very current mentors, Brian Patel, is the CMO of our health system, and is always looking out for providers and patients. Quality of care, patient experience, health
Yeah.
equity. He sort of covers it all, but he always does it from the perspective of a clinician, and he's just an amazing mentor.
Well, I've had a chance to get to know Brian, and he's a fierce champion for goodness. And
Yes.
yeah, I think yeah, he's making a big impact, and I can see that even though I'm multiple tiers out from where you are, he's an amazing guy making a difference. So Anyway, I want to again recognize each of you for what you do, and everything from being related to David Lee Roth to hacking a data set, to the amazing work that you're doing on the field as a trainer, and the life journeys that each of you have had as mentors, as physicians for your patients, as healthcare leaders. And I know that you're making a ripple effect in all sorts of different places that you probably have no idea have happened. And I'm so grateful for each of you, and your willingness to share the people that made a difference in your life. So anyway, so this is a chance to celebrate Doctors' Days, and if you uh, run across one, say thank you. And I think that each and every one of these physicians said their best moments were often about making impact and getting a feedback loop from a patient or even a colleague uh, that they made a difference as a clinician. So remember that as you traverse through healthcare. And anyway, I'm grateful for all of you. Thank you for what you do. Happy Doctor's Day. Keep your head up, take care of each other, love each other, because it's hard right now. And thank you for being a part of this.